Hello, and thank you for joining our webinar today on reallocating Continuum of Care resources. Your presenter will be Norm Suchar, and my name is Anna Blasco with the National Alliance to End Homelessness. I'll be running the Q&A portion of the webinar, which I'd just like to give a short introduction to before we get started. Norm, if you'll go to the next slide. There are two ways to talk to us today. The first is by entering a question into the questions box at any time. The next way is at the end of the webinar. We'll give you an opportunity to share your community's experience with reallocation. How you will do that is by clicking the little hand symbol that's highlighted here on the left-hand side to raise your hand. We will call on you and unmute your line, and then all of the attendees will be able to hear you. That's all. If you'd like to get started, Norm.
Thank you, Anna. Welcome everyone today to the webinar on reallocation. Let me just first start by giving you an overview of what we'll be talking about today. So just a brief little agenda. One thing I'll just note over the course of the webinar is that occasionally it takes a few seconds for slides to come up. So if it sounds like I'm talking about something but the slide hasn't shown up on your computer yet, usually if you wait about 3 or 4 seconds, it'll come up. And the other thing I want to quickly mention is that this webinar is being recorded, and we will post the recording within a day or two of this webinar. So if you don't keep up with everything we're saying, then it's okay. We'll send it out to you as soon as we get it up and ready. So for the agenda today, we're going to just talk about reallocation and what it means, provide an overview of reallocation, briefly talk about how to do reallocation, and then discuss what you should be looking for in your projects as far as candidates for reallocation, and also some recommendations we've put together for communities to look forward. Just a couple things I want to say. There are a lot of people on the call today. We probably have a few different people who have a few different roles in their community. I expect that there are some providers on the call and also some Continuum of Care leads. We'll be trying to make this general enough so that it makes sense for every audience, but occasionally we'll be talking things that probably don't pertain to you, and I apologize for that. So let's start by doing a brief overview of what reallocation means. So the first thing I just put up here is a slide that comes just straight from the fiscal year 2012 Continuum of Care NOFA. This is the NOFA that you just participated in this past December and January, and for which, if you were applying for a renewal project, you've already heard. If you applied for a new project, you probably haven't heard yet. But this is the text taken straight from the NOFA saying that collaborative applicants can reallocate underperforming supportive services only. That's what SSO stands for. TH, which is transitional housing, or PH, which is permanent housing, which includes rental assistance, and that S plus C is shelter plus care projects, to create new permanent supportive housing, rapid rehousing, or homeless management information systems projects during this competition. And reallocation of underperforming projects can be in part or whole as the collaborative applicant determines. And the collaborative applicant is another term that just simply refers to the Continuum of Care lead agency. So I just want to talk quickly about what exactly reallocation means and how it differs from another process called repurposing. So reallocation refers to changes in a Continuum of Care program that involve changing the type of program, or where you're significantly changing the target population. So let me give you an example. If you're converting a project from a transitional housing to a permanent supportive housing, for example, that would have to be done through this reallocation process, because you're changing from one type of program, transitional housing, to another type of program, permanent supportive housing. There are also changes that you can make through process called repurposing, which is just simply negotiating a contract amendment with your local field office. So this is when you're making more minor changes to programs that do not involve a change in the program type. For example, if you're making you have a transitional housing program and you're changing some aspect of that transitional housing program to make it operate more effectively, you wouldn't go through the reallocation process. You would go through this repurposing process. So let me just go through a couple of the differences in how these things happen. First of all, the timing is a very important difference. Reallocation only happens during the competition for the Continuum of Care Notice of Funding Availability. So it's just that 2-month or so period where you are doing reallocation. Whereas repurposing, doing a contract amendment to change a program, that gets done pretty much any time of year other than during an open competition. So the timing is very different in those. Reallocation tends to be a big process, so the fact that you have to do it during an open competition means you want to sort of have a lot of stuff ready before the competition opens so that you're prepared for that. So reallocation during the open competition and repurposing any other time. Reallocation, you can reallocate from almost any type of project. So if it's a permanent housing project, permanent supportive housing, if it's a transitional housing project, if it's a supportive services only project, you can reallocate from any of those project types, including what used to be called shelter plus care, what used to be called SHP, any of those. And you can reallocate to a few different specific project types. You can reallocate to a permanent housing project, which includes permanent supportive housing and includes rapid rehousing. You can reallocate to an HMIS, Homeless Management Information Systems project. And under certain circumstances, you can reallocate to create a new supportive services only project that does coordinated assessment. So the conditions there are that your community doesn't already have a coordinated assessment process, and you are reallocating from another supportive services only project. So you can take an existing supportive services only project, convert it to a supportive services only project that does coordinated assessment, provided that your community doesn't already have a coordinated assessment process. So just sort of to summarize what reallocation means, the reallocation process essentially allows you to create a new permanent housing or HMIS or a coordinated assessment project. But the key is that it's treated like a renewal project for scoring purposes. So as many of you are familiar with the Continuum of Care process, you've done it numerous times over the years, you always get your renewals or almost always get your renewal projects. But new projects can be hit or miss. Sometimes you get them, sometimes you don't. And reallocation creates a process where you can have a new project, and it gets treated and scored as if it were a renewal project. So as long as it meets threshold requirements, you're going to get that project. But of course, you have to trade in another project to make that happen. And another key point I wanted to point out is that you can reallocate parts of projects. So this is something that many communities have done, where they don't reallocate an entire project, but they reallocate parts of projects. And in fact, some communities have taken, a little from a few different projects to create one new project, and that may very well be a sensible approach going forward. So let's talk about how the reallocation process works and how you would do reallocation. So the steps are pretty simple, but it's important that you start early. So the first step is if you're a provider and you have a Continuum of Care grant and you're thinking about reallocation, the first step is to contact the collaborative applicant for your Continuum of Care. So the collaborative applicant is essentially what used to be called the CoC lead agency. It's going to be important that you do this in partnership, so your first call should be to the collaborative applicant. And then it's going to be very important to contact your field office as early as possible in the process. Especially during the first year, reallocations were challenging for a lot of communities around the country, and one of the ways that people who were more successful contacted their field offices early to let them know what was happening, and so the field offices were prepared, and where they needed advice from the headquarters office or to look things up to make the process run smoother, they had time to do that. So contacting your field office as early in the process as possible is very important, and even before the NOFA is published. So if you're thinking about doing a reallocation in the next competition, one of the first things you can do after this call is talk to your collaborative applicant and contact your field office as soon as you can. Another step is actually even before the NOFA is published, it's worth reading instructions from the previous NOFA and other guidance that HUD has provided about how to do reallocation. All the indications we've had is that the reallocation process this year will be similar to the reallocation process last year. So if you want to know how it's going to go, just read last year's guidance, and it will give you a lot of hints about what this year is going to look like. And then after the NOFA is published, this is kind of obvious, but just wanted to point it out because it's really important. It's important to read the NOFA very, very carefully, and specifically how you should do a reallocation and the requirements of the new project, et cetera. And then the last important thing to do to get ready for reallocation is that you really have to be ready to identify which projects you plan to reallocate during the registration process, during the CoC registration process. So this is even before the NOFA, what we normally think of as the NOFA process. Even before that starts, there's a registration process for CoCs, and there's a grant inventory worksheet you do, and all kinds of other things. It's important to identify those projects that you plan to reallocate during that process. Last year, HUD was flexible with communities and allowed them to make changes after their registration process. They've indicated that they don't plan on allowing communities to do that this year. We'll see what actually happens, but it's going to be much better for you if you can get everything squared away during the registration process. And one other point I just want to make briefly is there's sort of really two aspects to this reallocation process. One is that there's the stuff you do during the competitive process and the stuff you do for HUD. But organizationally, if you're an organization that's going through a reallocation process and you're converting your program or transitioning your program, there are a lot of other steps that you have to take entirely apart from the what you have to do for the HUD process. So the slide I've put up here is just an example of we have a guidebook called Organizational Change: Adopting a Housing First Approach, which has a lot of templates and suggestions and tools and timelines and things like that for transitioning a program and going through this sort of retooling process or this conversion process within a program. So I just wanted to acknowledge that this is really sort of two things that are going on. One is that you're doing stuff for HUD to change what your grant can fund, but you also are going through this with your organization and with your other funders to identify all the steps you're going to have to take as an organization to make those changes. So the next thing we're going to talk about is what kinds of steps you should take to analyze your projects to see which ones are good candidates for reallocation. So this slide that's coming up here has text from a letter from Ann Oliva, who is the Director of the Office of Special Needs Assistance Programs at HUD. So she's essentially the Director over the Continuum of Care process. And she's been communicating and sort of giving hints as to what HUD is planning on doing going forward. And from her letter, she wrote this in her May 6th letter, that it's important to analyze your portfolio of grants, see if you have the right mix of housing and services to meet the needs of homeless households, and begin considering whether funding for some projects in whole or in part should be reallocated in 2013 to make resources available for new efforts. Let's actually sort of talk about some of the different aspects of that. First thing I want to talk about is about the performance measures that HUD is requiring going forward, because this is going to be one of the main drivers of why you choose to reallocate a project, either as a provider or as a community. So these performance measures, hopefully everyone's seen these before. We've certainly been talking about them, but I've bolded the first one because this is one of the areas where reallocation can make a pretty significant difference. Reducing the length of homelessness, but the other performance measures as well, reducing the number of people who become homeless, reducing returns to homelessness, reducing overall homelessness, increasing jobs and income. There's a performance measure for other accomplishments that's sort of a catch-all for a variety of other things. And then also your thoroughness in reaching your homeless population. So these are the performance measures. And the important thing here is that you are, you're being measured not just as an individual provider on these performance measures, but you're being measured as an entire continuum of care on these measures. So to some degree, whether you're performing well as a provider is secondary to whether your community as a whole is performing well. And I think that what I've noticed in working with communities around Virginia and certainly around the country is that there are numerous projects that perform very well. But even then, it may be, even if you're a project that's meeting your performance goals, your HUD performance measures on a consistent basis, even then it may be worth considering reallocation, just depending on where your community is and how your community as a whole is performing. And whereas the HUD measures tend to be, have tended in the past to be benchmarks, so for example, the percentage of people who exit your project for permanent housing is a benchmark measure, and if you're exceeding it, great, and if you're not, that's not great. What HUD will be looking for more and more going forward is not just your overall level, but whether you're improving or not. So it's important to think of reallocation in the context of we as a community need to think about how we can consistently improve our performance on these measures. So if our average length of homelessness in our community is, and I'll just throw in a number here, that it's 100 days, then how can we make it 90 days? How can we make it 80 days? How can we keep improving? So it's not just that you have a set benchmark you're trying to achieve, but you're always trying to improve and get better. And for that reason, even if all the projects in your continuum of care are performing to HUD standards, you still probably want to think about, well, can we do better? Will reallocation help us achieve even better outcomes? So these are the performance measures. And I've written down some questions to consider when you're trying to decide whether to reallocate a project or which projects to reallocate. So the first question is, and this is sort of what we were just talking about, does the project help the community perform well on Hearth Act measures? So again, it's not just whether the project itself is performing well, it's does it help the community perform well, and it's not even just does the project help the community perform well, but could the project help the community perform even better on those Hearth Act measures? Another question that's worth considering, and this is something that people don't necessarily like to talk about much, but there are numerous Continuum of Care projects that return money to HUD on a consistent basis. Part of that, I think, is probably beyond the control of the project sponsors. Certain projects are certainly structured in a way that it's hard to spend every dollar every year, but numerous projects are returning money to HUD every year, so it's worth thinking about, well, could a part of that project be reallocated and we can keep more of the money in the community. Another thing to consider is that even when there's a project that is performing great and is doing great things for the community, it's to think about, is there another way to fund the project? And thus freeing Continuum of Care resources for a new project. So, for example, I've known about several healthcare projects, employment projects, other types of projects that were able to find other funding sources, either from a healthcare for the homeless program, or from local general funds, or from the Department of Labor, or from other places, and thus didn't need the Continuum of Care funds, and so the Continuum of Care funds could be reallocated for something else. So this is an important way to think strategically, is if there's another way to fund the project, then you can reallocate that grant to produce something new. And then the other thing, and this is one of the, I think, the hardest things to assess, is not just is the project doing well, but is the project better than what we could do with it, and what we could do with the funding if it was reallocated. So if you're a provider who is providing, say, transitional housing, and you're exceeding your objectives immensely, you have a great project, winning awards, etc., it still may be worth considering whether, well, is that going to get us better outcomes on our Hearth Act measures? Is that going to serve our community better than if we converted to permanent supportive housing or a rapid rehousing program? And the same with if you're a supportive services only project, HUD is requiring communities to do coordinated assessment. So maybe even if your project is doing great things and performing well, maybe your community needs the funding for coordinated assessment even more. So another thing to consider when you're assessing your project. I think HUD sort of describes this as evaluating underperforming projects, but really there aren't a huge number of underperforming projects in the country. It's as much looking at projects that actually perform pretty well, but where you could use the funding for something even better that's worth thinking about. So let's talk a little bit about some theoretical examples of what reallocations people are doing around the country, and kinds of reallocations that you can consider. Probably the most common type of reallocation that's happening around the country is the conversion of transitional housing projects. And people are doing two types of conversions. Primarily, they're converting transitional housing projects. When they're converting them to permanent supportive housing projects. So this is something that communities have been doing for probably close to a decade now through the Continuum of Care process. So converting to a permanent supportive housing project, particularly one that serves chronically homeless individuals, it can be very beneficial for your Continuum of Care score, certainly something that HUD is interested in people doing. So a lot of people are going that route with their conversions. And in recent years, in the last NOFA process, communities started looking at conversions of transitional housing projects to rapid rehousing projects. And I know that some providers around the state have been working on that, not just through their Continuum of Care grants, but through other grants. Another type of conversion that people are doing is the supportive services only projects. Again, this is something that people have been converting for many years now, largely because HUD used to have this incentive for for this housing incentive in the NOFA process, the housing activities score, where if your continuum of care had more of their CoC funding in housing versus services, they would get a higher score. So a lot of people shifted funding and resources from services projects to housing projects. But even now, people are looking at their supportive services only projects. And again, looking at a few different types of analysis. One, can this be funded with some other resource? I know of some healthcare and mental health projects that have found that they could be funded with, and also some substance abuse programs that found they could be funded with other resources and were able to free up continuum of care money for new permanent housing projects, and also the conversion of an SSO grant to do coordinated assessment in the community. People are also looking at underperforming permanent housing projects. And this is where I was talking earlier about permanent housing projects that are consistently returning money to HUD every year. This has been a problem in the Shelter Plus Care program, or what was formerly the Shelter Plus Care program. And it's something that's really worth looking at. If you're a CoC lead agency, it's important to look at the portfolio of projects and see how many are returning money to HUD. HUD doesn't always make it clear to the lead agencies or the collaborative applicants who is returning money and how much they're returning and how long they've been returning money for. But that's something that is worth looking at. So let me just give you one example. One community that we've looked at, they had several underperforming Shelter Plus Care projects, and they were able to, they essentially carved out a little of the funding that those Shelter Plus Care projects had been receiving and reallocated funding from several different permanent housing projects to create one new permanent housing project serving chronically homeless individuals, and that they were essentially able to do that without cutting into beds that were actually getting used and occupied. This was all carving part of the money that the community was returning to HUD every year, carving that out to create the new project. So that's another thing to consider. And then again, the issue of creating a new coordinated assessment process by reallocating a supportive services only project is another one. And we already sort of discussed the issue of reallocating parts of projects, which gives you a kind of flexibility when you're trying to create new projects. So let's go now to some recommendations we at the Alliance have developed. These are pretty simple, and I think most people will find these pretty obvious, but I just wanted to go through them anyway. One is that it's important to think about how you can look at your resources as an entire community rather than just looking at sort of the various parts of resources. So one thing we recommend that people do is they create a resource allocation plan for the entire community. And by community, I mean for the continuum of care. So look at resources, not just your continuum of care resources, but all your resources, and try to figure out how to be strategic about that. Okay, we as a community are spending, or as a continuum of care, are spending X dollars on emergency shelter and this much on permanent housing and this much on these kinds of services, and look at your performance and your resources as a whole to see whether how it makes sense to shift resources, and then to go to the project level and think about, okay, if we want to shift a significant amount of resources from, say, transitional to permanent housing or to shelter or wherever, you can then, once you've sort of made the decision as a community, you can look at individual projects and where that makes sense. So most of you, I think, have already sort of begun this process because, as part of your most recent application for state funding for the Emergency Solutions Grant, one of the things that each Continuum of Care was required to do was to create a spending plan. The graphic you see on the screen is just a sort of a screenshot from that spending plan template. And so you've probably already started to have some conversations about, okay, how do we as a community spend money? So now it's worth having, those further conversations. Okay, what should we be spending our money on in the next 12 months as a community, in the next 5 years? And then thinking about, coming up with action plans to figure out how to make that happen. It's important to review your community's performance on Hearth Act measures. Again, I just listed those same measures from before, but it's important to know where you are and assess, where your opportunities are to make progress. It's, I think, very important, and I think this is sort of underrated, is to try to convene major funders in your community and come up with a more cohesive plan moving forward. One of the challenges that we've heard about consistently from communities when they try to do conversions or try to reallocate or try to make major changes to their homeless assistance is that it's difficult to get all the funders on board with changes and to work together to make this process smoother and easier. So what you'll have is, most projects, for example, don't get all their funding from one source. So if they want to reallocate or convert their project, they have to talk to numerous different funders, and in some cases funders will be flexible, they'll be on board with the new approach, in some cases they won't, in some cases funders will be suspicious about what the project is trying to do, and in other cases they'll just feel like it isn't consistent with their mission and so they don't want to go along. This can make it very challenging. And the fact that providers have been so creative and innovative about blending together funding and coming up with non-traditional funding sources actually makes it more challenging to make changes and move forward. So as a community, if you can convene the major funders in your community, describe what your Continuum of Care is trying to do. If you have a 10-year plan in your community, what is that plan trying to do? What are your goals? And if you're, as you're planning on shifting resources to better meet Hearth Act objectives, to better meet the goals of ending homelessness, to better meet the goals of the state plan, bringing the funders in on what those changes are going to entail, what funders can expect from the projects they're funding, and also where they could be helpful. I think one of the things funders can do is fill some of the gaps that that you have in a community. So let me just sort of actually provide one example of where that can happen, and this also relates back to one of the challenges of doing a reallocation. So when you do a reallocation through the Continuum of Care NOFA, well, let me back up. When you do a project renewal, what I think a lot of people have noticed is that the NOFAs have been coming out later and later, and then the renewals have been coming out later and later, and this kind of creates a strain when your project starts on January 1st and your renewal doesn't come through until March, April, May. This can create a strain. And then there's additional strain because if you do a reallocation, it may even take longer. So while your scoring is the same and your likelihood of getting the grant is the same for renewal or about the same for renewal and for reallocation, the timing isn't necessarily the same, and so those gaps can create problems. So working with funders, local funders who can maybe fill in some of those gaps can be very, very important. And then another area where local funders can be, or other funders can be very helpful is when you have training needs or just project conversion needs, just things that you'll have to do differently and that HUD won't necessarily fund working with your local funders can be helpful in those ways. So convening the major funders in your community around the plan, getting their buy-in to the plan is really important. And then just going through and, as a community, reviewing all the grants in the portfolio. Are these projects, again, the same questions we had earlier, are these projects helping the community perform well on Hearth Act measures? Could they help them perform better on Hearth Act measures? Are projects returning money? Is there a way we can keep more of the money in the community? Is there another way to fund some of these projects? Again, another reason to convene major funders. Maybe you can figure out a more efficient way to fund projects, so you can create a new Continuum of Care project, and then looking at projects and saying, not just whether these are good projects, because most of the projects, even the ones that are undergoing conversion, are good projects that perform very well, but is it better than the alternatives and what we could be doing with this resource? So those are all the slides. I just wanted to reiterate a couple things before Anna comes on and gives more specific instructions. First of all, if you have questions, enter it into the chat box. But we're also very interested, and we've left a fair amount of time to make this happen. We're very interested to hear other audience members' experiences with reallocation, either when you've done a reallocation, tried to do a reallocation, or as you're preparing to do a reallocation. So if you have comments, please feel free to raise your hand, and I think the other providers and Continuum of Care leads and other stakeholders around the state of Virginia would love to benefit from your experience. So Anna, let me turn it back to you.
We don't have any questions or hand raised just at the moment, so we'll just give people 1 second. Okay, I think we have someone. Okay, Julie, do you want to share?
Yes, thank you. Can you hear me?
Yep.
Okay, great. This is great, so thank you to everyone who organized and presented. But Norm said that an allocation is awarded like a renewal, but as opposed to a new project. But I wanted to just confirm that, because have the reallocations been announced yet for the 2012 competition?
So no. So this is it's hard to think of a way to describe this, but when it comes to the scoring of a reallocation project, they get scored the same way as a renewal. So for example, when you're doing a new project, not only do you have to meet threshold requirements, but your overall COC has to score above a certain number to get the new project. So those new projects are very competitive, whereas the reallocation projects, they just fit into your annual renewal demand. Now, so in that way, they're the same. But in another way, which is exactly what you're getting at, they're entirely different, which is that the renewals get announced essentially, very shortly after the competition closes, whereas the reallocation projects take longer to get announced. And so this is where the timing issue comes in, that reallocation projects, you can be as certain as for a renewal that you're going to be getting a reallocation grant, but it takes longer to get there, and it's going to take longer before the money starts flowing. So in that sense, it's, there is an additional hurdle there.
Okay, I want to just ask a follow-up. I mean, that was great. But it appeared, and I might have been understanding this incorrectly, but it appeared to all of us who examined it that in the tier system, last competition, the Tier 1 and the Tier 2, which I assume will carry over to the 2013 competition, it implied that reallocations were given less priority than Tier 2 renewals. Like if you put a reallocation in Tier 1, it appeared when I listened to that presentation about the tiers, And it appeared that reallocations were giving less priority than renewals in Tier 2, which seemed to imply to me that it was treated more like a new project, or that if you reallocated something, it might be what is pushed down to Tier 2 as opposed to a renewal in Tier 2.
So the way Tier 1 reallocations are well above Tier 2 renewals. As far everything in Tier 1 is above everything in Tier 2 during the process. So if you put a reallocation in Tier 1, then as long as it meets threshold requirements, and it's a legal project and all that stuff, then you're going to be getting that project. Tier 2 is another story, so I'll get that. I'll get to that in a second. But for those Tier 1 projects, the reallocation, actually they put renewals first and reallocation second, and then they put a variety of other grants. So the bonus project, the planning grant, and any new things that you have under your pro rata need, follow after that. But only for the renewal and reallocation projects do you not have to meet any sort of scoring threshold as Continuum of Care to get those projects. In Tier 2, it's these things are going to go. They're going to fund. They funded all the renewals in Tier 2, and if there's enough money, they'll start funding all the reallocations in Tier 2 until they run out of money, or if they can fund all of them, they'll do that, and then they'll start funding. I can't remember what was next. I think the planning grants, Tier 2 planning grants, were next on the list. So in Tier 2, they're certainly not on the same footing as a renewal grant, but in Tier 1, they're on the same footing as a renewal grant. And the Tier 1, again, all Tier 1s are above all Tier 2s in the sort of funding process. Does that make sense? I always have trouble describing this stuff, and I'm never sure if I'm making sense.
That was, I don't know if I'm unmuted or not.
Yes, we can hear you.
Yeah, yeah, that was very helpful. That was very helpful, so I appreciate that very much.
Okay. Well, thank you.
If anyone else would like to enter a question into the chat box or raise their hand, please feel free.
And let me just say again, if you've had any experience with doing a reallocation, either this round or previous rounds, I'm sure other members of the audience would be really interested to hear how things went. And while we're waiting for questions, let me just sort of answer some questions that I think people probably have that I don't necessarily know the answer to. So I may just be telling you that I don't know the answer to that. One thing that I think people are interested in is the timing of the next NOFA. HUD has made clear that they are really trying hard to get this NOFA out quicker than they have in previous years. At one time, they were hoping to get it done by early summer, which is now. They're not quite on that schedule, but I'm sure many of you are on the list to get emails from the SNAP's office or from the one CPD, one of the one CPD emailing lists. But they've started this process of providing guidance. They're going to provide guidance over the 10 weeks leading up to the release of the NOFA. So they've already started providing that guidance. So if you're not already on those email lists, it's worth going to the one CPD website. That's onecpd.info. To get signed up for some of those lists, because a lot of helpful information comes from there. So we have one question here about examples of coordinated assessment projects created out of reallocation, and a little about what that might look like, and for folks thinking through that option. So let me again just briefly describe what it is that what it is that HUD is allowing, and what they're, how you're able to use that. So HUD is requiring that communities have a coordinated assessment process, and coordinated assessment just basically means that that there's a process by which people access homeless assistance in your community. It makes it easy for people to access, that they're assessed in a consistent way. So, for example, the same kinds of questions and eligibility determinations get made regardless of how they access assistance, and they are assigned to projects or programs based on that assessment process. So some people like to think about this as centralized intake, and that is the way they do it in a lot of communities. But in a lot of places, particularly areas where there's a large geography, so just getting everybody to one place would be impractical, they use a process where the assessment can be done at various different locations around the community. So that's the coordinated assessment process. Obviously, that takes staffing and thus takes money. And so what HUD is allowing is that you can take any currently operating supportive services only project and reallocate it into a new coordinated assessment project, provided that your community doesn't already have a coordinated assessment process, so you can't supplant in that sense. And so a few communities have taken advantage of this alternative. I think communities found it tough to take advantage of this, obviously, because as everyone I'm sure is aware, there wasn't, or it didn't look like there was going to be enough funding for all the renewals last year, and so it was a challenge to think about how you were going to move money around, and I think a lot of people didn't take advantage of this because they were just trying to get through the other stuff and figure out where they were going to make cuts and things like that. So, but a few communities have applied for this funding to do this, and it's as simple as just a matter of selecting one of the SSO projects, not applying for renewal for that project, and instead applying for a new reallocation project to do coordinated assessment. These things, the coordinated assessment grants primarily pay for staff that do the assessments, and then referrals to other agencies around the community. So it's actually a pretty simple process and simple grant, but that's the kind of thing that people have been doing with that. So Anna, do we have anyone else with a hand up?
We actually have another question that came in to the chat box. Okay. And this person's question is administering rental subsidies, paying landlords requires a lot of extra administrative work, and this person's interested to know if there's any additional support for operations like this in the, that HUD will be providing.
So this gets a little complicated. So I'm just going to sort of clarify the question the way I think I understand it, and I apologize if I get this wrong. But with rental assistance projects, there's a lot of money. There's a cost to it besides just the actual rent you pay to landlords. That it just takes resources to administer the program, to fill out the paperwork, to determine if people are eligible, things like that. So I will say that there has been some confusion around the country on precisely what kinds of things you can pay for out of the rental assistance lines and which ones you can't. So one thing I will say is I should not be the last person you hear from on this topic. You should probably check with the virtual help desk and other sources. But one thing I do know is that your rental assistance budget line is not just literally for the dollars that go to landlords for rent. That the cost of running a rental assistance program is part of that budget line, which is different from administrative expenses for running the project. And exactly what the difference is between those two things, I'm not entirely clear on, and I think HUD's been working on some guidance, and I know a lot of other people have had questions about that. But it's you can those rental assistance dollars can do more than just literally be the dollars to the landlord to write those checks. The costs of operating the project and those things are also, or operating the rental assistance line are also costs that are included in that budget line. I don't know if that makes sense. I think I probably partially answered that question for you, and unfortunately I don't know precisely where that all shakes out. But I know other people have asked HUD, and it's probably worth putting in a question to the help desk because this is a question that a lot of people have.
Great. So we have another question from Julie, actually, who has her hand raised. So I'm going to unmute you now if you want to ask your question.
Thank you. The examples, you implied in examples you gave of reallocation, and maybe I misunderstood that it would be like the same agency. Like if an agency had a project that was transitional housing and they wanted to change it to one for permanent housing, what they would do. But what if in the continuum needed to make a decision, A, what would your be advised on how to make that decision, and B, what would be the complications if it would then need to be a different provider, like a different nonprofit organization? For instance, in our continuum, there's a number of homeless providers that only serve families, and they currently have transitional programs serving families, and we might want to reallocate to, programs providing, targeting chronically homeless singles for permanent housing. So, A, what would be your advice on the process for that, and who would then, get to be the provider? And number two, are there other complications with HUD, especially in the thing that you already alluded to, that the renewals might become, the reallocation might be announced after, the date of a renewal of a rate that's currently going on? How would you then end it if you didn't have an answer yet on the reallocation? Is that clear enough?
Yes, yes.
Thank you.
And that's great. I'm glad you actually asked that, because that's a good, very good point. So I think, you can do both kinds of reallocation. Obviously, you can, a provider, and I think this is actually sort of, if you were to classify sort of two broad categories of reallocations, you can think of sort of provider-led reallocations, where a provider who's, again, as an example, we'll use providing transitional housing to, say, families with children and wants to do a rapid rehousing project. So they contact their COC lead agency and initiate a process of doing a reallocation and all that stuff. And that, in many ways, is the simple one, right? Everyone's in agreement, and it's not easy, but in some ways it is kind of clean and simple, and there are certainly logistics to work out. But the other kind, as you're talking about, is that it's not always the case that everyone's in agreement about what needs to happen and which populations need to be served. And maybe after going through this, you do find you have projects that are performing poorly, and you don't want to. You want to reallocate to another provider who you think might perform better, or you want to reallocate to an activity where that particular provider doesn't really have the expertise or the history, and so that becomes very challenging. And I think the key with those kinds of processes is there has to be a lot of transparency, and you have to build as much objectivity as you can into the process. And this is often a multi-year thing you have to do, where 1 year you're setting out criteria. Let me give you an example of what, so for example, in In one city, they decided that they were going to change the types of programs they were going to fund, not just in the Continuum of Care, but in the Continuum of Care and with other funding sources. They were going to change the types of projects they were going to fund, and they were going to, well, if you had one of the old projects that they weren't going to fund anymore, they were going to give you a couple of years, and then you were going to have to go, if you wanted money, you'd have to go to a new type of project. And that process actually certainly wasn't without hiccups, but it worked out over the long term. And what helped them is that they had a very clear process. They laid out, okay, these are the conditions under which we'll continue funding projects in the future. We won't fund these kinds of projects, or we won't fund projects that perform below this level, or we will only fund, we will look at reallocating the bottom 10% of our projects, or whatever the process is. It's important to get it out there, get it on paper, get at least some level of consensus. You never get complete consensus, but it's important to have a governing process that allows you to move forward even when you don't have complete consensus. But getting the process on paper is very important. And then just following through. And so trying to be as objective and transparent as possible is really important. The problems you have when you don't have an objective, transparent process is that there are so many different ways to undermine the changes you're trying to make. Political ways, so providers who feel maybe it's fairly, maybe it's unfairly, feel like they've been mistreated, will work with elected officials to sort of undermine the process, or they'll work with other partners they have to undermine the process. So you can really create a lot of problems if you don't have an objective process. The other thing I think that's important is to really get all the funders you can bought into what your overall strategy is going forward. If you have a performance strategy, so you say you're going to fund only the top 80% of performers, and I'm just using that as an example. But if you choose to do that, and then you're going to look at reallocating the bottom 20% every year, if that's your process, make it clear, communicate it to different funders, communicate it to elected officials and community leaders, have it written down on paper, make clear what the time frames are. Spelling all that out in advance is going to be really, really important. And you'll have arguments about it, and you'll want to just not talk about it because it's obviously very contentious. But the more you can spell that out, the earlier you can spell it out, the better off you're going to be. And I will say that a lot of reallocation happens that way. It is actually reallocations. Often it's, a decision is made that you're not going to fund a particular project type, and the provider just doesn't want to go in for the new thing, so they just sort of bow out. But occasionally it's projects that just are underperforming and really don't have the capacity, and they're essentially losing in a competition to keep their money. So that's the best advice I have for you. Anna, any other questions?
We have one question. This person would like to know, now that there is a beginning in infrastructure for rapid rehousing and permanent housing, will there be a funding focus on just stability or aftercare? What are the benchmarks for aftercare or stability that you can reference?
So so what I would do, and I'm actually going to, if I can, try to back up to go to this slide with some of the performance measures, because I think that's the answer to this question is, and I apologize for just flipping through slides so quickly, but that's the answer to this question, is that there's no particular benchmark for sustainability. So I'm assuming what you mean by sustainability is that, or what the question means is that when people exit homelessness and move into permanent housing, is it a situation where they is it a stable situation for them, or are they just going to become homeless in a month or two? And which is a very, very important concern. something that is very important to address in program design and very, very important to address when you're measuring the outcomes in your community. But one of these performance measures is reducing returns to homelessness. And so, and if you're performing poorly on that measure, so if your projects are resulting in people returning to homelessness, then that's going to reflect badly on your CoC score. So it is absolutely something you should build into your program design, and you should be considering very carefully as you're moving forward. At the same time, I think it is very, very important to use your HMIS data to assess the degree to which that's happening. I have talked to numerous people around the country who have objected to doing different rapid rehousing projects or permanent supportive housing projects because of a perception that it just wouldn't work and the program model was flawed and that everyone would return to homelessness. And then once the projects were implemented, it turns out that that wasn't the case. And when you look at the data, I've even talked to, strangely, people who run projects that were sure that their programs weren't going well. But when you looked at the data and what was actually happening to people, the projects were successful, and they didn't have a high number of people returning to homelessness. So if you want to look at specific, benchmarks as far as best practices, not related to, not that HUD is going to consider these kinds of scoring, but looking at what other communities are achieving as far as some of these benchmarks for returns to homelessness. I can give you a couple right now, but you may want to email me, and I can probably give you some better examples of that. But if you're looking at, say, a 12-month period after people are, rapidly rehoused, for families less than 10% is pretty good. For individuals less than 15% is pretty good. But most programs are doing, slightly better than those benchmarks I just gave you. It really depends a lot on the level of barriers that people face that you are serving, on how much assistance you're providing. It's very easy to have a person stable for 12 months if you provide 18 months of rental assistance. Much harder if you provide 4 months of rental assistance. But also, when you provide 4 months of rental assistance, you can serve, some number more people than if you're providing 18 months. I should have picked something that was easier to do the math on there. But so there are all these things to consider. And so circling back to your question, the stability, people's stability in their housing and not returning to homelessness is absolutely an important objective. It's something that HUD's going to be measuring. It's something that hopefully you as a community are already measuring and should continue to do so. And it is something that's going to factor into how well your CoC scores and should factor into how you run your programs. Any other questions, Anna?
We don't have any other questions.
Okay, so I guess we are looking at about 3:07, so we'll wait a couple more minutes. We'll take a couple more questions, and we can go ahead and leave early, finish the call early. Actually, did see one question here that there appears to be a lean toward women and children with limited resources and away from serving single men, even with men making up a larger percentage of the homeless population, and just thoughts about whether that's going to continue and solutions and et cetera. And I will say, I think there's a lot of truth in that. There are a lot of there's a lot of attention to. It seems like the attention these days is to people experiencing chronic homelessness, homeless veterans, and families with children. And I think that's true to a large degree. Some of that is almost certainly driven by the fact that there is a little more research on those populations, and so we do have a little better evidence about what the best practices are for those populations. Part of it is driven by the fact that there are large federal funding sources that are really dedicated to those populations. For example, there are a lot of mental health resources and healthcare resources devoted to people with chronic illnesses. Families with children, just by virtue of being more politically popular, I guess, have more resources available to them, more cash assistance and things like that. And veterans have their own department, and again, being politically popular, just have a lot more resources available to them, so there's been a lot more focus on those populations. That said, there's a lot more work that's starting to be done on single individuals. This is certainly a big issue for us at the Alliance. We have been looking at the application of rapid rehousing assistance for single individuals. It looks very promising. It looks like something that can be very effective. We're also looking at different shelter configurations that work better for single individuals. So we're starting to do some work, and I hope to close that gap that you have identified, and hope to see more in the future. And of course, we should be trying to end homelessness for everybody. But I think it's important to note that there is they are sort of the other groups are sort of moving ahead a little quicker, and yeah.
We have a question here. Someone would like recommendations for an SSO program that provides emergency winter shelter in converting to a rapid rehousing program.
I hesitate to provide too many recommendations over the phone because this is one of those complicated things. So step one is contact your CoC lead agency or your CoC contact and start talking through this. When you have some ideas, start talking to your HUD field office. Some things to think about are not just what your overall CoC score would be, but how would this work? If you what kinds of rapid rehousing, how would you provide rapid rehousing to what population? Who are the other stakeholders that really rely on the winter shelter? And how can you get them on board with your plan? I think it's a very ambitious and sounding plan, and I think it could potentially be a very good one. So I want to encourage you to explore it. But I think these are, the homeless assistance programs provide a role in their community, and I think it's important to really work with other members of the community, other providers, your CoC lead agencies, your local government, and really have them bought into the process as early as possible. Another thing that I have found is very, very important is working with your board very early in the process. Boards of directors can be either extremely helpful and beneficial to the process, or they can be a hindrance and a real challenge to the process. And a lot of that is just, your skill as an executive director or as a program director or whatever your role is in really bringing them along and helping them understand, why this is important and what you're doing. So I think the communication and bringing people on board is really going to be one of the biggest challenges and probably the thing that's worth starting with first. If you want more sort of specifics or to talk through more specifics, you should feel free to email me. And I realize I have not provided my email address to anyone. So let me go ahead and do that now. I'll just spell it out. And I didn't include it in any of the slides, unfortunately. But my email address, my name is Norm Suchar. My email address is N as in Norm, S as in Sam, U as in umbrella, C as in Charlie, H as in helicopter, A as in apple, R as in rat, I don't know, at NAEH, which stands for National Alliance End Homelessness, naeh.org. You can also Google Norm Suchar, and I'm practically the only one who comes up. So again, if you had follow-up questions, feel free to email me, and if there's someone I think who can better answer your question, I'll pass it on to them. But yes. Any other questions?
I also just wanted to let everyone know that the webinar is being recorded today, and we will email it out to all the participants. I don't see any other questions at the moment.
Okay, well, I'd just like to take this opportunity to thank everyone for participating in the webinar. Wish you the best of luck when the NOFA comes out in that process, and always encourage you, if you have any questions about any of the content on this webinar or any other things you think we can be helpful with, to contact us at the National Alliance to End Homelessness, and enjoy the rest of your day. Thank you.